Hello, sir. Good
Yes.
evening.
Yeah, good evening, Vidit.
How are
Can you
you?
hear me? I'm
Yeah.
fine.
Clearly
Yeah,
audible. Am I
yeah.
audible to you?
Yeah, sure.
Yes. All right. First of all, I would like to tell our viewers that this is the very first Facebook Live event that we are going on with, and which is totally related to the heart health questions and the queries that our community have brought forward. And we are also extremely privileged to have Dr. Virendra Sarwal, the renowned heart surgeon, and who is an extensive expertise and a dedication of cardiac care. So thank you so
Hmm.
much, sir, for joining us today.
Yeah, it's my
Yeah,
pleasure also.
yeah.
Yeah.
There our community has a lot of pressing questions regarding heart attack and
Mm-hmm.
heart-related queries. So we are here to have their queries solved, and you are the only person that can help us and our community to give the clarity and expertise towards this heart-related problems. So
Yeah,
let us
sure.
dive on to our very first question.
Yeah.
All right. So the first question we have is. Uh, a lot of audience members are curious about reversing heart disease. So, could you please
Mm-hmm.
explain some effective ways to accomplish that?
Yeah, actually, the scientific fact is that it's not possible to reverse the heart disease. But what happens is that if somebody has mild to moderate kind of deposits in the coronary arteries or the heart arteries, it's possible to stop the progress of the disease. So, what precautions what we take to prevent these plaques or obstructions to happen in the heart disease vessels? Same precautions we take very aggressively once we know that there is some deposit, but it is not very significant, and maybe it may be causing some small symptoms or something. But of course, there is no danger of getting a major heart attack or something. So when we say that we need to stop the progress of that disease, that means that we need to again concentrate on our dietary pattern. We have to be more strict about it. We have to avoid junk food at all costs, deep fried things at all costs, sugar things at minimum, and reduce the intake of the raw sugar. And along with that, regular kind of exercise. And especially for those here who are in the habit of smoking or alcohol, it's very, very important that the moment they come to know that there is some disease which has happened in their arteries, it's very important for them to stop it. So these are the few ways, and along with that, medicines. What we generally say, we have to step up the statins, which is a lipid-lowering drug, and we have to keep our LDL under check. And it should be the aim should be to bring it below 100, and it can be with the medicines as well as with the help of dietary pattern, which I spoke earlier. So both the things combined, and if we can bring down the lipids nicely below 100, and we can reduce on the other things, and especially smoking and alcohol is very, very important. That needs to be stopped.
All right. That was quite clear, sir. Thank you. Let us move on to our next question. The question that pertains significantly to our community members is Indians are more susceptible to heart disease. And how do the factors like ethnicity and genetics play a role? So this is a
Yeah,
question from
that is.
everyone.
Yeah, that is very true. I mean, not only Indians, we Asians are very, very prone to coronary artery disease much more than our Western counterparts or Western population. So it's because of the genetic disposition what we have as Asians, and of course to ethnicity, and the factor lipoprotein A, which is very common and very high most of the time in the Asians, especially Indians. That's why, if we go by the WHO report today, they have declared that India and especially the Asia is going to be the world capital of heart disease. So it's because of the genetic disposition. And looking at that, what has happened now is that we have started doing genetic profiling of all the siblings who have somebody in the family who has suffered a heart attack or has undergone a procedure for a heart attack. So it's a simple blood test, and which is 5 ml of blood is taken and sent to the labs which are available in India, and we get the reports in 2 weeks time, and it gives us DNA profiling of the patient, that what are the DNA kind of genes he is carrying, and whether he is carrying any bad genes which can make him develop heart disease or the coronary artery blockages. So we call it polygenic risk score. So it's a risk score which comes out of that blood sample, and it declares a person mildly at risk or moderately at risk or severely at risk. And if a person who is young and who is in the family of a heart patient comes to know that he is at a high risk or it is moderate risk, obviously it will motivate him better to take the precautions so that
Right.
the disease should not develop or it should not progress.
Correct. Correct. So that's incredible, insightful, sir. So, thank you for shedding the light on that. Now, the next question is, could you please advise us about some accessible methods to clear the heart blockages? Basically, this question is like a lot of community members needs to know, like how without getting any surgeries done or angioplasty done, what all things we can, it could be helpful in clearing out the heart blockages.
That's why I said, I mean, it's a question which is similar to the first question,
Yeah.
which said that can we
Regress.
regress the heart disease?
Yeah.
So again, here we cannot clear the blockages which has happened. It's already that cholesterol has got deposited, and we there are no means. There is no medicine. There is no other means that we can clear it out and make the artery clean. The only way is that if the blockage has grown significantly, that means the blockage has gone beyond 50% of the lumen and it is causing symptoms, then we have to go for certain procedures, which is again angioplasty or stenting or a bypass surgery. And I'll repeat it again that only way to not clean it, but little bit regress it. There are certain studies that if we change our lifestyle, because it's a metabolic disease, it's a lifestyle disease. So if we can change our lifestyle disease and along with certain medicines, which is statins, which I said in the beginning, then we can regress the plaque or the deposits to some extent, but they cannot be cleaned totally.
All right. So we need it. It could
Yeah.
not be cleaned. All
Yeah.
right. So yeah, that was really very helpful. Another concern that often raised in smaller cities is about again the accessibility. So, with what basic heart health evaluations can people easily access in small cities?
Yeah, that's a very good question because if we are proactive in defining that what we are carrying, what are our numbers.
Yes.
The American Heart Association has now said that it's not that at the age of 50 or 55 or 60 we should start worrying that I may get heart disease and I should
Hmm.
go for certain checks or health checks or something like that. Being proactive at a younger age, the American Heart Association recommends today that from the age of 20, one should be cautious that it doesn't, especially the siblings of people who have already heart disease in the family. So that is the age when people should get, or the children should get cautious about their lifestyle, because as I said, it's a lifestyle disease. So, what we recommend, especially today's times, the younger population or younger executives into multinational companies or working in corporate setups where there is a lot of high-end pressures and targets and chasing the time and
Yes.
dates. So what we recommend basic tests to know that what I'm carrying, the simple blood test which says blood sugar levels and the lipid profile.
Okay.
Lipid profile is nothing but level of cholesterol and it tells us about the bad and good cholesterol. And these are the two basic tests which the blood test should be required. And and along with that, in the Asians or Indians, which I said in the beginning, that lipoprotein A levels that should also be known. And another test which is very helpful because a lot of inflammation is happening daily in the body, which is homocysteine levels. So lipoprotein A, homocysteine, blood sugar levels, lipid profile, these are the blood profiles one should get it done. And these are generally available, commonly available in all areas, whether it is metro cities or semi-urban areas, and even to some extent to there is home pickup from the rural areas also.
Okay.
So along with that, we should get our basic ECG done so that we
Hmm.
know that what is our basic baseline rhythm and baseline configuration of our ECG, and is there any indication of any blockages on a resting ECG. And further to that, two tests are very important. One is the echocardiography. Echocardiography is nothing but a ultrasound of the heart. And when we do the ultrasound of the heart, we get to know how all the walls of the heart are moving. Are they contracting well? If they're contracting well, that means they're getting enough nutrition to do that job, and that nutrition is blood. So that clarifies that there should not be much blockages there. And third test, which is very important, is a treadmill test. When we stress our body, the heart has to work more. The heart rate goes up generally. This is the normal body response or normal heart response to any
Correct.
exercise or extensive work. So when the heart is working more and we monitor the ECG that time, so that means it is trying to draw more blood from the same arteries what it is carrying at rest. So if the arteries are blocked at some stage, we will have some changes in the ECG when we are doing a treadmill test. So treadmill test is nothing walking on a treadmill, or in a layman's language we say that walking on a patti jisko
Correct.
treadmill bolte hain.
Correct.
It's just like cardio exercise in a
Yeah.
gym. So only difference is that we monitor the ECG during the that increased workload on the heart, and if we find some changes, so that gives not exactly 100% but 90% indication that there may be some blockages, and one needs to go for further tests. So
All
all
right.
these
That
tests are
was
available generally in most of the areas,
small
and
cities
now,
as well.
yeah, yeah,
Basically, every small cities, all the people can get all these
get all these tests.
easily.
Yeah.
Yes, this was like very informative, and everyone should know about it. So yes, thank you so much, and let's move on to our next question. The differences between the symptoms of acidity, angina, and panic attacks, and how are they related to heart stress?
Yeah. So that is another very, very important question, because many times we get patients into our clinics or into emergencies saying that I'm having some acidity, and I even burped, and I went to the washroom also, and there is some sweating and all, and it's a gastric problem.
Okay.
So, if I have to say, it's little scary, but I have to mention it here that if we do the heart test or we do certain tests and do the ECG, actually it is a heart attack which is happening. So the right side of the artery, right artery of the heart, has a common tendency to behave as acidity, and we generally get symptoms or pain or kind of side discomfort in the epigastric region. Epigastric region is just below the tip of the sternum, so where the stomach is there. So now looking at this, that these kind of symptoms can be a heart attack. So we call them as atypical symptoms for a chest pain or angina. Like typical angina is starting on the left side of the chest and going to the left arm. But atypical angina, what we say is that dental pain, jaw pain, neck pain, shoulder pain, back pain, or epigastric pain or epigastric discomfort. So now the thumb rule for this is that if somebody is having these kind of symptoms, epigastric discomfort or burping or something like he's feeling acidity or something, the thumb rule is that first get the heart disease ruled out. And again, by those simple tests which I mentioned earlier, which is a ECG, TMT, and echocardiography. So get these two, three things done, and along with a blood test, which we call troponin I. This is an enzyme. Whenever there is something happening to the heart muscle, this gets released into the bloodstream, and if we can monitor that, that gives us a fair indication whether the person is having a heart attack or it's simple, it's a gastric symptom. So if we rule out the heart disease and all the tests become come out to be normal and they are negative, then we can safely treat other diseases like gastritis or gastric ulcer or epigastric pain or shoulder pain or muscle pain. So that's not a big deal. So any discomfort in the chest area or in the neck area or the back area and the stomach area, the first thing should be that one should rule out a heart disease and then treat the other symptoms.
All right. I am not so familiar with this technical terms of medical, but I get got this very clear. It was crystal clear how, if any of the things happened, we had to rush to doctor immediately.
Yeah.
That was very informative, sir. Meanwhile, when you were saying, we received one more questions from one of our community members. So just 1 second, I'll take that up,
Yeah, yeah.
which is very important. So this is the question. Uh, I have been diagnosed for CAD in 2009 and have been on medication since then. In 2016, angiography was done following a shoulder pain, but the percent of block on LED remained almost same as that of 2009 when CT angiogram was done. My medicines are metoprolol, yes, S Ecosprin 75 mg. I am having inflammation at various parts of the body, and the recovery is prolonged. My question is, with the prolonged use of above mentioned medicines may be a cause. I am 69 years old. This is a question by Madhu Sudhanan Pillai. I'm so sorry, it is not clearly visible, but this is the question, sir.
Okay.
So,
So, whatever the query he has put in, I mean, basically he had coronary artery disease in 2009 and he got it tested with
yes,
CT angiogram and there was some blockage, some percentage of blockage which he has not mentioned. But 2000,
metoprolol,
that is a tablet, that is
yeah,
a treatment.
yes, yes,
So
yes.
what I'm saying, 2009, whatever percentage of blockage he
Hmm.
had, it is the same at 2016. So that's a good part. It relates to the same thing which I said in the beginning,
Hmm.
that we can stop the progress of the disease with medication and diet and regular exercise. So that means he in those 7 years from 2009 to 2016, he has been able to control the progress of the disease and it is remaining the same, and the medicines what he's taking is fine. Along with that, I don't know whether he's taking any statins. That is very important. And what is his lipid profile? So looking at his lipid profile, he should look for the LDL levels and triglyceride levels, and if they are deranged or on the higher side, he should start some statins, and statins on a slightly higher dose, so that the it's good that he could contain the plaque and it could not progress in last 7 8 years, but now further also it should not go beyond the permissible limits to cause him any problem or further heart attack.
So now he was 69. But nowadays in media, we have been hearing a lot of news about young people getting heart attack. They refer to as cardiac arrest or heart attack. So how are they relatable? Is it arrest a result of heart attack, or are there any other reasons for cardiac arrest?
There can be other reasons, but mainly what we have been reading in the media and what we have found, some celebrities and going for the gym, coming back and suddenly collapsing, were the heart attacks. And it's very true. Younger patients are getting into heart attack. That's why I said in the beginning that American Heart Association today says, don't look at your heart at the age of 55 or 60. Start looking at it from the age of 25 and 30. So know your numbers, that what the numbers are, whether you are prone to getting a heart disease or not, and getting a genetic test done. And the basic reason for getting a major heart attack in younger patients today is, it's very clear. It's a phenomenon of burnout.
Yes.
Uh, we as physicians and medical experts have been blaming COVID for that. That blood got thicker and there are clots roaming in, and it is causing heart attack in the younger patients. That is one part to some extent, but major part which I feel is the burnout syndrome. What is happening, which I said in the beginning, that younger population is now into more extensive kind of stress because of their work. They have to chase the timelines, they have to achieve the targets, and they're always constantly, and the timings are not very stable and streamlined. Somebody is working till 12 o'clock in the night, somebody is working till 2 a.m. in the morning. So there is a simple principle that body undergoes a lot of inflammation. When I say inflammation, that means swelling throughout the day. So 16 hours, the body is under constant turmoil and is getting a lot of inflammation because of the way we are working. We are having stress, a lot of hormones getting secreted in the body, and tackling the situations. So that stress level is there. So, if the earlier days, if you see that as kids, or if I say when in our times,
Yes.
there used to be a very strict regime that you get up at 6:30 or 6 o'clock and
Correct.
have to go to bed at 9 o'clock or 10 o'clock to have minimum 8 hours of sleep.
Yeah.
So that there was a reason, there was a scientific reason. It was not a ritual, it was not a family practice. The ritual, the scientific reason is that body has to heal in those 8 hours for the next day.
Okay.
And if we start accumulating sleep hours that we are not sleeping, I slept for 4 hours, next day I slept for only 2 hours, next day I slept for 6 hours. So the inflammation in the body will never heal. It will keep on accumulating, it will keep on increasing. And that inflammation comes to the heart arteries also. And when they are constantly under um, not good hormones or bad hormones
Hmm.
because of the stress in the body, and they are not resting, and the arteries are the lining of the arteries is not healing, then ultimately somewhere down the line it leads to a major heart attack which cannot sustain life. So that is the basic reason. So I was part of one of the studies, and this has been done by American Heart Association again, that
Okay.
the hours of sleep cannot be 7 hours. It has to be 8 hours or 7.5 hours, not less than that. So it's scientifically proven. I mean, I was very amused that one group from US, younger generation, again executives into the corporates, they
Hmm.
said that Saturday, Sunday is free with us. If we sleep both days, can't we recover the sleep for the 5 days?
Correct.
So that's wrong. It doesn't happen like this. So as I said, every day after 16 hours, for 8 hours, body has to heal itself, and there is no other way but to sleep properly. So that is one part, and the other part is the younger generation going to the gyms and doing heavy exercises and in
Hmm.
competition. Somebody
Yeah.
says I have lifted for 140 kgs, the other person says no, I can lift 160 kgs. So that's a bad
Yes. Yes.
competition. I should know what my body can bear with, and
Hmm.
what my numbers are. Am I diabetic? Am I hypertensive? Am I prone to a heart disease in future? So looking at that, we have to streamline our exercise routine also. So
Uh,
these two, three things combined, the burnout and excessive use of exercise is leading to younger deaths.
as you mentioned about exercise, like an expert shared with us, like when we exercise, new smaller veins are formed. When we do regular cardio exercises, that improves our blood flow, and in turn, it helps in keeping our heart healthy. So, can you just tell us more about how effective exercise could be, and in which extent we should do, so that possibly it could control our heart disease, and not only by diet but also we can control it by doing exercises, right? So, how could we accessibly take it, not more than that and not least in that, so that it could affect our heart in a positive way?
Yeah. So exercise does not increase neovascularization, or as you said, smaller channel formation. It only happens if one major artery is blocked. Then
Okay.
there are smaller channels that get bigger if you are exercising.
Right.
But the thumb rule again here is that normal walk 30 minutes to 45 minutes a day, at least 5 days a week. So that is good enough for your body to have
Hmm.
good increased flow and good oxygen intake into your lungs to maintain your heart health and body health. Maybe it can be a brisk walk, but there it has been scientifically
But
proven that there is no extra benefit in jogging or running and other kind of forms. So simple walk at normal pace or maybe a little brisk pace for about 45 minutes a day and 5 days a week is good enough. When it comes to gym or other kind of strenuous exercises, it's basically for bodybuilding. Like you want to build up your muscles.
Hmm.
It's not for the heart. So you
That's
want to have
true.
six packs or like celebrities or something. So then probably one can go for those kind of exercises or weightlifting or something. Because simple is that when we are lifting weights, the muscles are working against resistance or against force, and they will thicken up. It's the same with the heart. If there is a person is hypertensive, has a high history of blood pressure, the heart has to exert more and against resistance. So the muscle gets hypertrophied. So here also what we see biceps or triceps or back muscles or abdominal muscles, they get hypertrophied because we are lifting regularly weight. The moment you leave it, they will regress back to the normal. So that has no benefit for the heart health. Heart health only requires a regular, normal, or brisk walk for 45 minutes a day for 5 days a week. That is good enough.
Okay. So few of the unnoticed or uncommon symptoms of heart attack could be a jawline, a jaw pain, or anxiety and restlessness. So it can be an it is basically not noticed by the people. So can it affect the heart health? Is it is like does it play a very crucial role in getting a heart attack? Like this jaw pain, shortness of breath. Like shortness of breath, we totally get it that it is totally we relate to that only. But when you talk about jaw, so that is a new symptoms that has been found. So is it actually
Yeah, like I said earlier, one is the typical angina, which I explained the pain on the chest side of
yeah,
the left side of the chest and relating to the arm, left arm. And then atypical angina. So what you have mentioned is that these are all atypical symptoms of angina itself. It can be a jaw pain, it can be a tooth pain, it can be a neck pain, it can be shoulder pain, it can be back pain, it can be epigastric pain. So these
stomach
are,
pains?
so if they are happening frequently, investigate yourself. And it's very simple that if somebody is getting these symptoms frequently, just go to the nearby doctor and get an ECG done. So if there is some angina happening,
So it's mute. So by mistake, you have sorry, you have muted up. I guess it's mute.
yeah.
Yeah.
So
Yes. Sorry, you were unable to.
So
Or
yeah, so
hmm, right.
basically, once we have all these symptoms and they're happening frequently,
Hmm,
the best thing is to do is to go to a nearby doctor, get an ECG done,
hmm.
and during this pain, if there are some ECG changes, so it is definitely angina. It's not a tooth pain or it's not a shoulder pain, and then we should go further and get investigated and treated accordingly.
All right. Thank you so much, sir, for your beautiful insights. And these were the questions of our community members, Sarah, then Govind, and Archana, Alon, Kanade, Pradnya, Vijit, and I guess I hope you all guys have got your answers like very clearly. Still, if there are any queries that has to be taken care of, please send it. And we have Virendra sir with us, who is happy to help and give good response and a very clear, crystal clear response that you can get here. And thank you so much, sir, for your time, for your valuable insights for our community members. Hope to see you again very soon. Thank you so
Thank you,
much, sir.
Vidya, and
Thank you
it's
so
always
much
a
for your
pleasure
time.
talking on the heart health, and I think everybody should follow it. Thank
Yes,
you so
yes, sir.
much.
We will definitely follow. Thank you so
Yeah,
much. Thank you.
thank you.